Hi everyone, my name is Amanda and welcome back to another EPICS Lab Talk. Today I will be discussing difference and differences analysis. For an outline of my presentation today, I will be discussing first an introduction to natural experiments and quasi-experiments, then I will move into exploring difference and differences analysis and finish with an example of an application of a difference and difference analysis. So before getting into what natural and quasi-experiments are, I first wanted to provide some insight into why we might want to conduct these types of experiments. Randomized control trials, or RCTs, are a gold standard study design used in epidemiology. The use of randomizations to assign treatment status or intervention in this type of study design allows for the estimation of the effect of that intervention or treatment independent of other factors. That is, randomization can be used to balance confounders, known and unknown, between intervention or treatment groups. However, while RCTs have very robust study designs, they cannot be ethically applied to many exposures of interest in public health, such as studying the effect of smoking on various health outcomes. Observational study designs are useful in epidemiology as they can be used to study exposures that cannot be randomly assigned. However, the lack of randomization then requires a control for confounders, whether they be measured or unmeasured, as the presence of unmeasured or residual confounding can bias estimates obtained in an analysis. And while statistical methods can be used to control for confounding, unmeasured or residual confounding is always possible. Natural and quasi-experiments are useful in that they can allow researchers to study exposures that cannot be easily randomized. They do so by leveraging an external source of variation in exposure, and they can be considered a sort of combination of experiments and non-experiments. Natural experiments can be considered a study of unplanned events or naturally occurring events such as an earthquake. In natural experiments, exposure allocation is not under the control of the researcher, and the allocation of the exposure is independent of other factors relating to the outcome. In this case, control for confounding is not required, as the process can be considered to be effectively random. Quasi-experiments, on the other hand, are evaluations of planned events, such as policies or programs aimed at influencing an outcome. Here, the researcher may be able to influence exposure allocation, and given that this is therefore a non-randomized experiment, it does not resemble a random process. So a difference in differences analysis is a type of analysis that can be employed in a quasi-experimental design. There are other statistical approaches that can be used, such as propensity scoring, interrupted time series, or regression discontinuity, but today I will just be focusing on difference and differences. To illustrate how difference and differences can be used as an analysis, I wanted to provide an example. The example I provide here is the implementation of a HPV vaccination program in Ontario and HPV-related cancers. In this hypothetical study, a HPV vaccination program for grade 7 students was implemented in the province of Ontario, and the outcome of interest would be to study the rate of HPV-related cancers several years into the future. So to study whether implementing an HPV vaccination program helped to prevent HPV-related cancers, we could conduct what's considered a pre-post study, in which we examine the rate of HPV-related cancers before and after the implementation of the vaccination program. We could, for example, subtract the difference in rate to examine the effect of the intervention. However, there is one main limitation to this approach. Given that we are only examining the province of Ontario in isolation, in which the intervention was implemented, we are not able to account for whether there could have been any exogenous factors that could have also influenced HPV-related cancers that could be acting at the same time or around the intervention. To mitigate this, we would need to include a control group. In this hypothetical example, we could consider the province of Alberta, where perhaps no HPV vaccination program was implemented. However, there was available data on rates of HPV-related cancers. In order for Alberta to act as an appropriate control group in this case, the two provinces need to be considered similar on all important factors other than the implementation of the vaccination program. Similarly to how we looked at the province of Ontario, we could compare the rate of HPV-related cancers in Alberta over the time period in which the vaccination program was implemented, and the difference in outcome could be used to examine how the rate of HPV-related cancer changed over time. Now that we have both our intervention and control groups, what we can do is we can compare the rate of HPV-related cancers between the two provinces before and after the vaccination program was implemented. This allows us to calculate a double difference between groups and time periods that produces the difference in difference estimate. The difference in difference estimate estimates the average impact of implementing the HPV vaccination program on the rate of HPV-related cancers in Ontario. So the double difference between time periods and intervention groups, or in this case, provinces, allows us to estimate the difference in HPV-related cancers that is unique to the province of Ontario because the province of Alberta acted as a control group to control for any time-varying changes that may have influenced the outcome. When modeling difference in difference designs in practice, different statistical models can be used based on the data at hand, for example, a linear regression, a Poisson regression, or a logistic regression. However, basic difference in difference models contain three variables: an indicator variable for the exposure, an indicator variable for the time period, and an interaction term between exposure and time period, which is the difference in difference estimate. When conducting a difference in differences analysis, there are two main assumptions that should be considered. The first is the parallel trends assumption. The use of a control group is to act as a counterfactual and aims to demonstrate what would have occurred in the absence of the intervention. We need to have a control group in this sense so that we can control for time-varying factors that may be influencing the intervention. To ensure whether the parallel trends assumption is met and whether we've selected an appropriate control group, we can visually examine the pre-intervention trends in the outcome between the two groups. In our example, we could compare rates of HPV-related cancers between the provinces of Ontario and Alberta before the vaccination program was implemented. And if these trends are similar, then Alberta could act as a valid counterfactual in our hypothetical study. However, non-parallel trends indicate that our control group does not act as a valid counterfactual, and in this case, using an improper control group could bias the estimate by either over or underestimating the effect. In some cases, visual examination of parallel trends is not sufficient, and regression-based methods could also be used. Another assumption to consider in difference in differences analysis is the independence assumption. The difference in difference design assumes that the allocation of the intervention was as good as random. This implies that the intervention was implemented independently of group-varying characteristics and time-varying factors, and the assumption can be verified by comparing baseline characteristics between intervention and control groups. Additionally, a researcher could describe the rationale behind the implementation of the intervention to further illustrate that the implementation of the intervention could be considered as good as random or independent. There are a handful of methodological considerations that should be considered when conducting a difference in differences analysis. The first is the choice of a control group. As I previously discussed, violation of parallel trends assumption indicates improper choice of control group. This can be mitigated by using synthetic controls. One could also be considering whether there may be a lead or lag time effect. In a lead time effect, We may see outcomes happening prior to an intervention, and this would be evaluating by looking at pre-intervention outcome rates. And in a lag time effect, this could occur when the implementation or effective outcomes may not occur immediately. In the example of HPV-related cancers, it would be several years before the cancers would appear. So we would see a lag time before the effect on HPV-related cancers would come into play. To mitigate a lag time effect or account for it rather in your analysis, you could build a lagged impact model. Additionally, we should be considering whether there may be any residual confounding, such that perhaps a time-varying confounder may impact either our intervention or control group and not the other. This can be mitigated by sensitivity analyses. And finally, spillover effect. This occurs when the intervention may extend to control groups based on proximity. As an example, if a study were to be performed in a classroom, for example, an intervention happening in one class may spill out into other classes in the same school due to conversations between students. An approach to mitigate this would be to use an alternative control group, such as, for example, a class of students at another institution, or conduct sensitivity analyses. Finally, I wanted to provide a brief example of an application of a difference of differences analysis. This application comes from a thesis project for a master's student conducted in our lab. In this case, the interest is examining adherence to enhanced prenatal syphilis screening. In the province of Ontario, there has been a rise in infectious syphilis rates among women aged 15 to 44 years over the past couple years. This has led to an alarming rise in congenital syphilis. In response, certain public health units in Ontario have issued enhanced screening recommendations in which they recommend that pregnant people are screened more frequently for syphilis during pregnancy. There is a need to evaluate the effectiveness of these enhanced recommendations to see whether they may be effective in addressing the rise in congenital syphilis. The application of this design, similarly to what I already discussed, is used to examine the change in outcome between two time periods and between two groups. In this case, our two time periods will be before and after the enhanced recommendations were issued, and the two groups will be public health units in which there were new recommendations issued compared to public health units in which there were no enhanced recommendations issued. We can compare the average rate of adherence over multiple time points in the intervention and control groups between the two periods to get our difference in difference estimate, which allows us to estimate the difference in adherence rates that is unique to the public health units that had the intervention. That concludes this EPICS lab talk. Thank you so much for your attention. I have added some resources here on natural and quasi-experiments, as well as difference of differences analysis. Thank you.